G'day, my name is Dr. Ollie. I'm here to help. I'll be your neurologist for today. I just finished reading your intake form. Appreciate you taking the time to fill that one out in advance. But from what I gather, it sounds like you're here after experiencing a bit of a bump to the back of your head after having a fall. Is that right? Yeah, a few weeks ago. And it says here that you've been having some off symptoms, not feeling yourself. Can you tell me a little bit more about that? Okay. Brain fog and dizziness. I see. Yeah, it can be very common after any type of head injury. But tell me, has this dizziness, has that been persisting for a few weeks now? And maybe is it worse when you, for example, turn your head left, right, or maybe when you're rolling in bed? Things that involve head movement. I see. Yeah, that tends to make it worse or reproduce those symptoms. Okay. I see. Well, I'm glad you already had a CT scan or computed tomography scan after your initial injury. It says here that everything from that scan was clear, which gives me a lot of confidence that what you're dealing with is nothing to do with our central nervous system. But we'll do some digging, some investigating. I'd love to do a thorough neurological screen, particularly for your cranial nerves, to see if we can find the root cause of what's causing your dizziness symptoms, and to rule out any serious or nefarious pathology. Okay. All right. Why don't you get comfortable, have a seat. Where you are is fine. And I'll just get my gloves on, get things sanitized. Okay. So, how's your day been so far? I see. Been watching a lot of TV. Have you seen that new show, Off Campus? Yeah, it's pretty good, isn't it? I'm up to the season finale, actually. Yeah. No spoilies, please. No spoilies, I beg of you. Who knew they could make ice hockey so interesting? As an Australian who's never played, it's pretty riveting. But I'll just get my gloves on. Yeah, it's like High School Musical grown up. I know, but here we are. That one on properly. There we are. So, just a quick screen for our cranial nerves. We do have 12 pairs, but we'll be doing a more succinct exam, testing just over half of them to start with. We've got our ophthalmic nerve, optic nerve, our eye muscle nerves like oculomotor, trochlear, abducens. We'll do some facial testing as well for cranial nerve 5 and 7, trigeminal and facial respectively. Some hearing tests as well, which can give us an indication for your dizziness symptoms. So that's cranial nerve 8, our vestibular cochlear nerve. Also do some voice production and speech checks as well for cranial nerve 9, our glossopharyngeal nerve and cranial nerve 12, hypoglossal nerve as well. Sorry, info dumping. Yeah, a bit of a nerd. But let's start with some of our cranial nerve tests. To begin with, I have here a hot and cold little specimen jar. So one is hot, as you can see there, one is hot, and the other one I have here is a cold jar. So yeah, one with hot water, one with cold water. I'll ask you to close your eyes, so no cheating. We're just going to place this on various parts of your face and neck region. Okay. Just so I know that you can feel the difference in temperature to begin with, just give me your hand. Pop that on the palm of your hand. So that is hot. Yeah, that is hot. And this one is cold. Can tell the difference quite easily. Yeah. Okay, now just closing your eyes. That's it. Closing your eyes. Keep them closed. How many fingers am I holding up? Good. You have no idea because your eyes are closed. Now, let's try. How does this one feel? Good. And this one? Good. Here? Okay. Here? Okay. Here? Okay. Here? Good. Couple more points. Here? Just try that one again for me. Yeah, that's it. Yeah, that area can be a bit tricky, but that's fine. You got it. And just here. Good. One more time. Nice work. Okay. Yeah. Actually, just one little spot here next to your forehead, right there. Okay. Very good. It's 100% accuracy there. All good and reassuring signs so far. Let's start now, or let's move on to rather sharp and dull, or sharp and dull, or soft touch. Yeah, 2-point discrimination. So it's my little hand. It has little pointy digits. Don't worry, I'll just test that on your arm. It's more of a back scratcher, really. So nothing too pointy or sharp like a thorn. And our little cotton bud. So same thing. This on your shoulder. Yep. And this on your shoulder is the sharp one. Okay. So again, do it on your face on various sections, closing your eyes for me. Good. Don't make me put a blindfold on you. Okay. Just kidding. Okay. Alright, let's try this. Here. Good. This one. Good. How about this? Good. And this. Excellent. How about out here? Yeah, that side. Okay, good. And just up in this area. Good. Alright. And just lower on the face now. Yeah. Okay, good. And a little bit. Okay. One more time. Just try that again for me. Yeah. Okay, you got it. Just humour me one more time on this side. Yeah. Okay. Very good. Yeah, no, that was fine. Just had to check that sort of cheek area slightly. But no troubles. Okay. Now, another thing we're going to try is called 2-point discrimination. 2-point discrimination. So I'm going to use my little fingers here to touch your face at the same time, and you should be able to feel that there are two different stimuli touching you at the same time. It shouldn't blend into one feeling. It should feel like two distinct points. So my little fingers here, just doing your cheek, forehead, those areas. Okay. So let's start with maybe your eyebrow area. Okay. So closing your eyes. Now, can you feel 1, 2? Good. And this eyebrow now. 1, 2. Okay. And just the forehead area. 1, 2. Let's try that again. 1, 2. Good. Just the bridge of your nose. Yeah, just bridge of the nose here. Okay. Good. One more time for me. Nice. And just the cheek here now. Yeah. Okay. Good. Good. Other side. Okay. You can feel the difference. Yep. Nice work. Just lastly, in the chin region. Okay. Yeah, just that chinny chin. Good. One more. Okay. Nice. All of this is reassuring so far. Have a little break. I'll organize my tools, and we'll keep going. Here we are. So next one, sense of smell, ophthalmic nerve, cranial nerve 1. Now closing your eyes for me. Thank you. Just got something underneath your nostrils now. Underneath the nostrils, can you tell what that is? Should be a fairly distinct smell. That's right. Leather. Yes. Okay, now just going to test your hearing. Have with me our leather case. So, testing your vestibular cochlear nerve for your hearing. And I want you to close your eyes and tell me when you can hear the noise. Yeah, we're going to assess your left and right sides. Tell me when you can hear the noise. Okay, eyes closed for me now. Good. And tell me when the noise stops. Good. And again, tell me when the noise stops. Good. All right. Trying the other side now. Tell me when the noise starts. Good. And tell me when the noise stops. Nice work. One more time for me. Tell me when it stops. Good. No, that was really good. Yeah, everything's reassuring so far. Sorry, I mean to bump you. Let's test our coordination now. So first off, rapid alternating movements, dysdiadochokinesia. I want you to test this with me. So having your palms out in front, palms out, good, and palm facing me, palm facing you, palm facing me, palm facing you, alternating. To try to do it with the rhythm of my voice. Okay, counting with me. 1, 2, 1, Uno, dos, uno, dos, uno, dos. Ichi, ni, ichi, ni, ichi, ni. Isa, dalawa, isa, dalawa, isa, dalawa, isa, dalawa. Very good. Ein, zwei, ein, zwei, ein, zwei. Good. All right. Yeah, no, that's fine. It's just a coordination test, which so far is looking good. The other thing as well for your coordination is just a finger to nose, making sure your depth perception is working okay. I have with me some little dog stickers of my dog Scout. Scout. That's him, yeah, on his 3rd birthday. Obviously a caricature drawing of Scout on his 3rd birthday. He's a wizard, Harry. But what I'd like you to do is look at Scout, touch with your finger back to your nose and back out to Scout. Yeah, so you're touching your nose, boop, touching Scout, back to your nose, boop, back to Scout. Okay, easy. All right, nose, Scout, nose, dog, nose, dog, nose, dog, nose, puppy, nose, puppy, nose, dog, and lastly, nose, Scout. Okay, good job. You can have that one for free. We have 100. Usually give them out to the kids. But the other thing I'd like to assess are some of your facial muscles. I started voguing there. But some of your facial muscles. So if you could please raise your eyebrows for me. Yeah. Raise the roof. Yeah. And then looking down with your eyes, just your eyes, yeah. That's good. And what about puffing your cheeks for me like a pufferfish? Nice big balloon with the cheeks, puffing the cheeks. Very good, very good, very good. Okay, and then doing a smile for me. You don't have to show teeth, just, yeah, raising the ends of your lips. Okay. And then just a frown for me. Yeah. Good. That's it. Have you seen that new movie, Obsession? It's like Freaky Nicky with the frowning. But sorry, I'm obsessed with that movie. But that's good. Just an indicator of your facial muscles, oculomotor muscles, cranial nerves, controlling those areas. So I promise there is some science and method to the madness. But I digress. Let me just check how we're going for time. Looking good. What I might suggest now is a quick voice production check. So repeat after me. I want you to say, Sphinx of black quartz, judge my vow. Sphinx of black quartz, judge my vow. Yes. Good. And just one more time, slightly louder for me. Just want to hear your voice production. Sphinx of black quartz, judge my vow. Yep, that's good. Yeah. It's sounding okay, nice strong vocal production, no hoarseness or gravelly sort of noise attached to that, and no pain, I hope, as well. Good. Yeah, it's a new one I use. It's a pangram, contains every letter in the alphabet, like the quick brown dog jumps over the lazy fox, but yeah. All right. We're actually going to do some light reflex tests now with my little pen light. What I might suggest is we move into the dim room so that we can do it without potentially flaring up your dizziness and brain fog symptoms that you mentioned earlier. And has anything so far brought on your dizziness? Anything we've done in today's assessment? Okay. I see. So that, like looking up, or when you were moving your head side to side quickly for some of those tests. Yeah. Okay. I see. No, that's interesting. We'll touch back on that very soon, but for now, let's do these light tests to make sure your reflexes are all okay. Yeah. All right. Follow me. Let's go into the other clinic room. We'll do those light tests now. Okay, this way. Alrighty, thanks for joining me in the other clinic room. Let's just examine your eye light reflexes, testing some of those cranial nerves. What I'll get you to do, please, is focus your attention on my finger here, or fingers, and I'll just be applying this light near your eyes, observing for your pupillary light reflex. That's it. Just focus on here for me. Very good. Alright. Seeing a normal response there in that eye so far. Let's focus on this one now for these two fingers for me. Good. Just checking on this side. Things are constricting and dilating as they should. Just compare that to the other side. Okay, yeah, just focusing here for me. Yeah, nearly done. Okay. Good job. Just a little bit on this angle. Okay, that's good. No issues there so far. Reassuring once again. But now, just with your visual field, I want you to focus on the tip of my pen as we move through an H or H pattern, testing for something called smooth pursuit. Yeah, like when you're reading words on a page, for instance. So yeah, part of our optic nerve, cranial nerve testing. Following on the tip of this pen, yes. Good. So try not to point that directly in your eyes. So, starting up here, nice vertical movement as we go up and down, cross, completing the H, completing that H. Good. Good. Bit more horizontal movement there. That's it. Good. Keep your head still. Yeah, no need to move your head there. Okay. Alright, and then up, down, up and down. Okay. Now we're going to try that same thing, but just moving your head as well as your eyes for me, okay? Just going to tell me something about your symptoms. Alright. So yeah. So moving your head side to side as well as your eyes. Yes, that's right. Okay. And now up and down, up and down, up. Just holding that upper position. Good. And turning your head while in this upper position. Okay. And then down, down low. Good. It's a circular pattern now. Okay. Just making sure that neck is moving smoothly, tracking well with your eyes too. Okay. Very good. Yeah. Feel alright there? I see. So maybe when you were looking up, that elicited some of your symptoms. Dizziness. Is that settling down fairly quickly? Okay. I see. Now we'll come back to that. But thank you for telling me. Yeah, it's important. If you do feel the symptoms, yeah, please let me know, like you have done. So, I appreciate that. We'll continue for now, but I'll come back to that very shortly. Okay, let's try our Z or Z pattern now. Same thing, following the light, just in a slightly different pattern, a bit quicker now. That's it, follow along as best you can. Alright, now I'm going to try moving diagonally, quite sort of rapid changes in position, testing for something called saccades. Yeah, S-A-C-C-A-D-E-S, saccades, where you can change your eye location quite rapidly from point to point, as opposed to smooth pursuit. So let's try this diagonal movement. Diagonally. That's good. Yeah. Diagonally. Here and here. Here and here. Here and here. Here and here. 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 Okay. What about here? And here. Here. And here. Okay. And my nose and the pen. Nose to pen. Pen to nose. Good. Alright, that's looking good so far. Just trying now, focusing on our sticker from earlier. Can you try turning your head while maintaining your vision on our friendly furry friend here? That's it, turning your head this way, turning your head this way. Okay, that way. Good. And that way. Good. Okay, and up, and down. Okay, this way, and this way. Good. Alrighty. Also looking okay. Very nice. Now, what I might suggest is we head back into the original clinic room. It's a bit dark in here. Not the coziest vibe. But we'll head back there. And I think I know what's going on, is the good news. And it's also good news. It's something I think we can fix today, in fact. So we'll talk more. Yeah, follow me. We'll head to the original room. Okay, let's go. Okay, welcome back to our clinic room. Bit better lighting, I know. But like I said, I think we found the crux of your dizziness issue and symptoms. Fortunately, we've cleared any serious pathology. I don't think this is something to do with your central nervous system or cranial nerves. But there is one other test I'd like to do to rule in a specific condition that I think you might have. So this specific test will bring on, or a high likelihood of it bringing on, your dizziness symptoms. However, it is a sort of brief 10 to 20 second window of experiencing those symptoms. It should settle down rather quickly. What's going to happen is we're going to do the Dix-Hallpike test. Dix-Hallpike, Dix-Hallpike, whereby I am going to take the full weight of your head. I'm just going to turn that roughly 45 degrees and just going to move back rather quickly on the edge of a bed or plinth, with your head hanging off the edge just by 10 to 15 degrees or so. It's nothing too crazy, but don't worry, I'll take full weight of your head. You just have to go loosey-goosey, just go with the flow and let me move your head for you. Once we're in that position, I'll just observe some of your eye movements, okay, for any abnormalities, and that's the test, okay? Really quick, promise, will be over in 20-30 seconds max, and so will your symptoms, okay? Nothing invasive, nothing painful as well. Alright, so let's get you up on the plinth. Just behind you, just have so sitting on the edge, and like I said, just going to turn your head about 45 degrees. Yeah, let me take the full weight, and then we're just going to lean back. That's it, leaning back. Good, just until you're on the edge of the bed there. Very good. And hanging that one. Yeah, okay. Now I'm just going to observe your eyes there. Just hold that position. Hold that position. 5, 4, 3, 2, 1. Okay, just slowly bringing your head to that neutral position, and yeah, go ahead, sit up nice and tall on the edge of the bed for me. Okay. Alright. How did that feel? No symptoms. Okay. Alright, no, that's okay. We're actually going to try the other side now. So I tilted your head this way. We're going to tilt our head that way now. Same thing. Yeah, testing for different sides. So let's try tilting your head 45 degrees this way. And again, leaning back. Yeah, a little bit quicker than that. Good. And head just resting about 10-15 degrees over the edge there. Holding that 45 degree tilt. Good. Stay where you are. Just observing your eyes. Yeah, I see. 5, 4, 3, 2, 1. Okay, just straightening up there. Sitting up nice and tall for me. Okay. Now, any symptoms with that one? Yeah, that brought on your dizziness. Yeah. Okay, well, this pretty much confirms my suspicions. I'll just jot that down. So what we just did was, like I said, the Dix-Hallpike test for something we call BPPV, or benign paroxysmal positional vertigo. And we just had a positive test on the left side. I always get my sides confused. But yeah, going towards that way. So positive test, Dix-Hallpike. So, what does this mean? What is BPV? BPPV. Essentially, benign, non-life-threatening, nothing serious. Paroxysmal, meaning a sudden onset or worsening of symptoms. Positional, referring to positional changes, in this case in the head or the inner ear. And vertigo, referring to that feeling of spinning, or like the room is spinning without you actually moving. So that false sort of spinning feeling. Marry all the terms together and we get BPPV. Benign paroxysmal positional vertigo. Can be very common after, in your case, a head injury. It can also just come on idiopathically or randomly or without rhyme or reason in some people. It can be age-related as well. There's post-viral infection. There's many different reasons or causes, but in your case, I think it's from that little head knock that you took a few weeks ago outside the Brazilian barbecue restaurant. Yeah. So what actually happens inside your inner ear, you have these tiny little calcium crystals. Yeah, it sounds a bit wacky, but they are in there, these tiny little crystals. And they can get dislodged and sort of float around in the fluid-filled canals in your inner ear. Talking very tiny, yeah. But the good news is this is something that's been very well documented, well researched, and there's a lot of positive treatments we can do right now, actually, within our session to alleviate and fix your symptoms, or fix those little crystal positions in your inner ear. Does that make sense? I hope I haven't nerded you out. Yeah. I appreciate that. I feel like knowledge is power, so yeah, it's good to for you guys to know this too, I feel like. So yeah, I appreciate you wanting to learn. So let's move on to the treatment technique. This is called the Epley maneuver, Epley, and similar to what I did before with the Dix Hall pike, I'm going to get you to do a few positional changes. So first off, doing that same 45-degree tilt to this side, to your left. Yep, good. And then we're going to lie you back down. Yes, just like that, just like before. That 10-degree tilt. So, yep, just staying there for about 10 seconds or so. That's it. Lying there. And then, okay, we're actually going to turn your head 90 degrees that way. So to the right. Good. Okay. And then we're going to roll onto your side. Rolling on, yeah, that's right. Just repositioning, rolling onto your side there. Good. Almost like your nose is looking down at the ground now. Yeah. You're holding that position. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Okay, slowly straightening up, rolling onto your back, and sitting upright to finish there. Okay. Nice. So that's our Epley maneuver. Yeah. No symptoms. Okay, that's good. Because yeah, this again, we're literally trying to reposition those little calcium crystals within our ear. Yeah. What I might do is, this is something you can do on your own, actually, as a treatment technique or an exercise. Very common vestibular exercise to help with BPPV. What I might do, let me type up a little fact sheet for you. I've got plenty of resources on this in our file system. Here we are. Where they always move where they keep it. Here we are. Yeah, BPPV fact sheet, and I'll just include the Epley maneuver in there. Is that alright if you give me your email address? I'll flick that through to you now, just so you have it all. It'll have diagrams, how often you should do it, when you should stop it if it is, causing you a lot of discomfort, because it does reproduce some of your symptoms. Things like that. Yeah, go for it. What's your email? Okay. I was going to guess Yahoo, but no one really uses Yahoo anymore. Cool. Alright, just double checking. That's 2. Yep, 2. Okay, yep. Gotcha. Alright. And send. Okay. So that one should come through any time now. Yep, got it. Very good. Because like I said, that's a really important fact sheet you can refer back to. We try to recommend doing it 1 to 2 times daily, that Epley maneuver, until your symptoms subside and you no longer experience that dizziness feeling. So the prognosis for this is quite good. Stick to it for a couple of weeks. Some people even a couple of days is all they really need, and things sort themselves out. But yeah, if you do start to feel those symptoms again, I might fill out a referral as well to one of our vestibular physios that I work with. Yeah, physiotherapist or physical therapist. They can help you with this kind of thing as well. And they might even have some other ideas to help with your dizziness if it does come back on. But yeah, vestibular physio could definitely help. Yeah. Okay. I'll email you their details as well. Let me just tap that on there. I think his name's Oliver. Yeah. And send that through as well. Okay. All right. So you have the details there. If you ever need to call the vestibular physio for a follow-up or something, just because sometimes I might not be available here. Yeah. So if it's to do with the BPPV, I give that physio a call. They'll sort you out. Okay. Well, keep up with that Epley maneuver. Everything makes sense, I hope. Good. No questions? Then, in that case, I'll leave you to it. Take care. And feel free to chat to the receptionist on the way out if you want to leave a review. Hopefully a good one. But otherwise, my name has been Dr. Ollie. It's been a pleasure seeing you today. And hopefully you feel a bit more reassured and knowledgeable in what's happening to you. So, take care. I'll see you next time. Well, hopefully not. Okay, bye now. Thank you to my awesome patrons, Andres Orlan Vasquez, James, Astor, Scott Walker, Kirsten, Josh, Patrick, Gabriel C., Will Hume, Emma, Here's Mikey, Chad Moore,